Tell us a little bit about Dr. Garcie.
I am a chiropractic physician licensed in the state of Louisiana and have been for 30 years. Prior to that, I served in the U.S. Navy as an independent duty corpsman. And I have been, like you and I met, I was the chiropractic physician, one of the team docs for the CHL mudbugs.
So we were talking via Facebook this weekend, and you were trying to explain, I thought pretty damn well to a bunch of folks, about the new coronavirus numbers, including some of the CDC statements that are X number percentage undiagnosed, that things may not be as horrendous as the mainstream media is making it out to be. Where on earth do we start with any of that?
I first became aware of it watching a Fox story. I believe it was this time last week, early last week.
And this is about the double testing, or at least they're combining numbers. Explain to me what we're talking about.
What I saw was it was a story where they were speaking about the increased number of cases of coronavirus, just that generic language.
Since most places went sort of into that phase 2 and everything else.
Well, yeah, except for the video they were showing was of people specifically getting antibody tests. You could tell it was an antibody test because it was a drop of blood on a small cassette. And so that's when I started thinking, well, unless they're talking about hospitalizations and people that are PCR positive, which is the swab up the nose, then it sounds to me like they're combining and adding the numbers of antibody tests to the number of people that are actively infected with the virus. And
they've admitted they're doing that.
Exactly.
They have admitted it.
Yes.
The CDC has, or
well, I saw a newspaper or some type of article online where there was a spokesperson from the CDC that made the comment.
And how does that? Let's assume for the moment, if the CDC says they're doing it, they're probably doing it. What does that mean if they're combining test numbers? How does that affect the numbers that are being made public and in a lot of cases have people sort of freaking out?
Well, I would think that it would affect the degree that public officials are using their decision making to keep things shut down, to keep things in a certain phase and not move forward. Because instead of talking about the people that are sick and actively sick and contagious and in the hospital and getting sick enough to die, which is a direct look at the active virus, they're putting the numbers of the analogy that I've heard used and I've used myself is the rearview mirror. An antibody test is looking to see that you were infected with the virus and that your immune system fought it in most cases without you even knowing it, so that you were either never sick at all or you were so mildly sick that you didn't seek care. And when they spoke about it, they even specifically said most of these cases are the young and asymptomatic. That should not be an active COVID case. There is a difference between having the virus and having the disease.
Speaking of having had the virus.
Yes, our producer,
what's everybody looking at?
Ruben Wright, believes real strongly that he had the virus.
Tell her the story if you
know.
know.
Now, my wife had an invasive procedure not too terribly long ago, some weeks ago. And, of course, first things first, they have to test for the virus.
Yes.
And sure enough, her antibodies came back positive.
Her antibodies?
Antibodies. Once her antibodies came back positive, they sent her to go get a nose swab to make sure she wasn't actively sick. And she wasn't. So she had the virus already. It had come and gone without hardly any symptoms. She complained for a little while.
Tell us about your theory going back to...
And see, I felt a little ill not long after Highland Parade.
Which is what? Late Feb?
Late Feb, yeah. And
which were the earliest cases.
And it was just, I felt a little fevery. I felt kind of wheezy, but it passed after maybe 4 days. And I never actually checked my temperature to see if I had a fever, but I don't know if I did or not. And then maybe a week and a half later, my wife starts complaining of feeling sick, feeling weird, not feeling right altogether. And
So you
of course,
started this crap.
the whole time she was like
Patient
that.
zero.
I was like, "Oh, you're a hypochondriac. You're just paranoid from watching the news too much." So basically, I'm a jerk.
Yeah.
She thought it was like allergies or pollen, right? It was that
Well,
sort of thing.
I kind of had
And
her
it's
convinced.
mistaken for that.
Had her
But you
convinced
haven't
that it
had the
was.
antibody test yet.
I haven't been able to get to my primary care to get the antibody test
Okay.
yet.
You brought one.
I did. Was her antibody test where they drew her blood or pricked her finger?
I think it was a finger prick test.
Okay.
I'm pretty sure.
The difference there is this is what they call a qualitative test. It's positive or negative.
Right.
The blood draw where they stick your arm is quantitative, where they actually get a numerical value for the amount of antibodies that you have.
Okay.
So it's the analogy that I use because I'm big on them is it's about the same as the difference between going and getting a home pregnancy test or going to the hospital and getting your blood drawn to find out how pregnant are
Yeah,
you.
because nobody ever panics when they do those home tests.
Exactly.
So this finger prick thing is better?
It's cheaper. It's faster.
Okay.
Those are the two things. Is that it's much less expensive, and it's the results are ready in 15 minutes.
Okay.
But my thing has always been, what difference does it make? Just like somebody that misses their cycle isn't going to go to the hospital in 3 days. They're going to go to the drugstore.
Sure.
And if that's negative, you can have false negatives.
Okay.
But you're probably going to wait before you go to the hospital to get an actual numerical value for the
Well,
pregnancy
sort of,
hormone.
just to be sure, could we test, because you're using the little needles here, could we test Ruben 4 or 5 times? Would that be a possibility? Because he's
We
got
can
10
stick-
fingers.
know,
we can
I've
stick
already-
all of his toes and fingers.
You know, I've already eaten bugs and put myself in danger enough
Yeah,
for
you
this
have,
job, so
yeah.
I might
Tell
as
you
well
what,
bleed.
why don't you wander around?
Run around, yeah, and
All right,
and we'll
leave your mic
I don't
on
want to
over there.
watch.
No, don't turn your mic
Don't
off.
turn
Turn
my
this
mic
one
on.
on,
No,
though.
and
Turn it on.
this one on.
Yeah.
I'm the producer here, all right?
Yeah,
I know what to do.
Hush up over there. I just can't watch the needle, so I'm gonna have to look away because the
serious?
needle makes me a little queasy.
You'll never
Now-
see it.
I'll never see
Renese,
it.
tell us about this. This is, what's this called? You said there was a special name for this kind of needle, or a retractable?
Well, it's really nice, and I found out about it through, give a plug to LiveShare. They showed me these kinds of needles, and it's wonderful because there's no sharps disposal. The needle pops out, and it pops right back in.
So there's no biohazard.
No biohazard, right.
So if you're in the biohazard business, things aren't looking good for the next 5
And
years.
I had initially thought that I was going to have to get that service, which is a little costly. But this is terrific because whether it's the blood that's on the card, the cassette, or the blood that's on the alcohol prep pad, it's no more than a gentleman cutting himself shaving. You just throw it in the trash.
I cut myself on the no, I'm serious. I cut myself on the
The wipes bottle, yeah.
on the wipes thing this morning.
Oh,
Yeah.
left.
It's just
Oh
easier
boy.
for me to get
Okay.
to.
I
So
play
you're-
guitar. Can we
you're-
do? Can we do
I'm
another
going
one?
to stick the finger I want.
Okay.
She's sticking the good finger.
I know.
And I would like to say there's been a lot of talk about the accuracy of these things. And in relation to Ruben's wife, the antibodies that she got back. This is the name of this virus is the SARS-CoV-2 virus because to separate it from the original SARS virus. It is one of the coronaviruses. The common cold is a coronavirus.
You just grimaced. You okay?
Ruben
dear?
just winced.
I
So-
didn't feel anything. I was more scared.
What
than
were
anything.
you? I have heard from a lot of people that some of the antibody tests are bad. You go to one place and it's negative, and you go to another place and it's positive. Is this a different type of deal?
I don't know about some of the others that are out. This one specifically tests for the SARS-CoV-2 virus.
Okay.
But let me qualify
Your
that with
blood
this
is like
statement.
Mrs. Butterworth's syrup. It's like viscous.
That's mean.
Years of abusing his body.
Is that what
Yeah.
it is?
Yeah,
Tell
yeah.
you what, let's go to break.
I can't go to break.
He can't
go to break where?
Well, that's right.
Someone will have to hit a F9 for us.
No, leave it on. He'll be done in a second.
I just do you have a Superman Band-Aid you can put on him?
There's no Band-Aid necessary.
No
No, he's got
Band-Aid
those new
necessary?
Band-Aids for people of color.
Oh, okay. Oh my. And it really 15 minutes?
Actually, positives show up. Positives reveal themselves much more quickly.
Okay, wow.
But I have to wait 15 minutes before I can call it negative.
Okay, gotcha.
Or positive.
Is it like a pregnancy test? It'll have a plus or minus
All right,
sign or
I'm
something?
It'll have
gonna
a
jump back over
line.
to the board.
Okay.
There's
I'm gonna bleed all over the board now.
There's a line.
Wouldn't be the first time.
There's a line for the control, which means that it right amount of blood, right amount of reagent, nothing wrong with the card.
Okay.
And then there's a line that says G and a line that says M. The M is the early stage IgM antibody. The G is the late stage IgG antibody.
So he would be a G if he's
He
had
should,
it.
if the history presents itself correctly, it would be G.
It would be
without.
G.
And how long ago? This was
Late
February,
yeah.
I believe.
Yeah, you wouldn't even have, because you can have both of them. You can reveal both. There is some
Okay.
overlap. Right.
Wow.
So
Okay.
the best result is to get any line on the G, whether it's with the M or not.
Okay.
Because G presents itself in 14 days, and 14 days is the contagion period. All of the
Let's
quarantine.
take a break now. We'll come back. It's going to be about 10 minutes, 15 minutes till Ruben's ready. I've got lots more questions
Yeah,
because
me
I'm just that
too.
inquisitive little fella.